Morning, everyone. I'm Lindsay Fershnick, your host for Workforce Transition Resource Management Team Commentary, where we're bringing you the info for your transition needs from PCS to separation. Today, I had the privilege of interviewing CWO Jeffrey Burrup. He is the base Portsmouth Clinic Admin Supervisor, where he gave us an overview of items you need to do upon PCS reporting. Just a reminder to please update your TRICARE program within 90 days of PCSing or any other life changes. This will help prevent any billing, or you won't be able to change it unless it's open season, typically in November.
Health Services Administrator for Base Portsmouth Clinic. If you're new to the area or coming in under PCS orders, our clinic provides routine services. Those include primary care medicine, primary care dentistry, immunizations, general lab work. Within our dental care, we also have a periodontist here, so we're able to provide some more advanced level care for dentistry. We do have a pharmacy on site with a pharmacist, so we are able to provide prescriptions, plus over-the-counter medications such as Motrin, Tylenol, Sudafed, things like that, antacids. We do perform minor surgeries. Those minor surgeries would be something like taking care of providing sutures for an open wound, maybe removing some moles, or doing things in that regard. Anything beyond that, we refer out. We also have referral services, and we're able to provide health benefits advice. We do not provide dependent care, at least not at this time. I do not have an estimate on if our clinic would be able to provide dependent care in the future. I will say that with health benefits advice, we are able to provide advice to any eligible beneficiary, and I can go into that a little bit later down the line. As far as what are some major factors that you all should know, well, the Coast Guard transition to MHS Genesis, and MHS Genesis is our new electronic health record system. To be frank, it's the first totally electronic health services system that the Coast Guard has had in over 20 years. But the entire military health system switched over to MHS Genesis. This is your primary tool for scheduling appointments, for messaging providers, for requesting information, and also for viewing recent notes that were entered in MHS Genesis. So patients do have the option to go in and download copies of their medical record. We are in the process of digitizing health records, and that's part of a larger program for the entire service. What I can tell you is that your entire record is not viewable through MHS Genesis currently. The records that are viewable in MHS Genesis are those recent records where that care has been performed in MHS Genesis in that system. So to give you a rough timeline, the clinic here switched over to MHS Genesis in November of 21. So any notes from November of 21 through currently, those will be viewable in MHS Genesis. We also have a patient guide that we have posted on not only our SharePoint page, but we also have QR codes linked in our patient brochure. And all this information is also available not only through our SharePoint website, but we have a Teams page dedicated for patient advisory committee meetings. And we hold patient advisory committee meetings once a quarter. And those are in person, but we also do it on Teams because we understand that folks may not be able to make it through the tunnels or through the tolls, or they could be underway but still have connectivity, or you may just not want to drive to the base, and that's fine. We still want to provide you with that information. So when we have these meetings, we discuss quarterly readiness updates, any recent changes to staffing, any updates to medical in general, but also we include a bank of resources, including TRICARE and medical links and beneficiary information. This information is also available on tricare.mil, But what we've done is we tried to streamline that and put that into like a 2-3 page brochure that covers everything from new baby, adopting, unfortunate death in the family, and also transitioning from active duty to retiree status. So we have that information. It's updated regularly, and it's also available on our Patient Advisory Committee Teams page. The other options for care is we do have our Duty HS. Our Duty HS is available 24/7 and reachable by Duty cell phone. Duty HSs should be contacted anytime a member seeks outside care for emergent or urgent care while they're on leave, or maybe they're just traveling. It's also good to reach out to us, especially for things like COVID, or you have developed a sinus infection or something like that, and you woke up and you're sick and you need to get some care. Difference between ER care and urgent care. ER care should really be reserved for loss of life, limb, bleeding uncontrolled, loss of eyesight. This is truly for some type of a life-threatening emergency. ER care should not be utilized because you woke up with a sore throat and you think you may have strep throat, or you think you may have COVID. Uh, that's really not what the ER is for, and it tends to overburden staff, and it also drives up healthcare costs. Again, an antibiotic or a simple medication received in the ER is marked up roughly 300% more than what you would receive here or at an urgent care. Urgent care, now that is something where we can refer folks out to or do a retroactive referral for individuals. Urgent care would be for a sinus infection, or you think you do have strep throat, or you slipped and fell and you think you may have a bad sprain, or potentially a broken ankle. If you need to get that ruled out, then yes, we can authorize urgent care. Sometimes we authorize urgent care because we're just overbooked and we can't get you in the amount of time that you need for that urgent or acute condition, and we will authorize urgent care. For those things, you can also go through our front desk with that and call our main line or our Duty HS. What are some timelines you should know about, or just in general? Base Portsmouth is the largest impaneled clinic. What that means is we have the most patients enrolled to this clinic than any other clinic in the United States Coast Guard. That number is roughly 3,600 individuals assigned directly to us or supported overseas. We are also the largest major cutter home port in the Coast Guard. How does this affect timelines? Well, because we have so many patients, this does sometimes drive up wait times significantly, especially for routine dental care. Some of that also has to do with our staffing model. Our staffing model is below standard, and it has been, but the Coast Guard is doing their best to try and correct these staffing models Coast Guard wide. But like anything, it will take time. We try to mitigate those gaps by providing you the most compassionate and efficient care as possible, and by utilizing MHS Genesis and the messaging systems. With that, though, please note that good care does take time, and that's true regardless of where you receive your care. We do have periodontal services that are added. We recently received Lieutenant Commander Gunn from the Navy, and he works here with us full time, but will also be making trips out to Trayson's Yorktown and E-City clinics to assist them with periodontal care, and is still maintaining a working relationship with Naval Medical Center Portsmouth to perform on-site procedures there as well. The last thing with timelines or scheduled events is the first Tuesday of every month, we have a TRICARE representative from Humana here on board in the command conference room. They're here from 7 to 11 every first Tuesday of every month. What this means is any eligible beneficiary. So basically anybody who has a military ID that is receiving TRICARE benefits of some type can actually come in and speak face-to-face with a TRICARE representative to have their questions answered. This is also a great service for ombudsmen. Ombudsman can come in, speak with the TRICARE representative, and get the latest updated information and post that on the unit's Facebook page or the unit's page in general, and provide this information out to family members. We also have uh, our TRICARE Humana rep, usually either in person or online when we do our patient advisory committee meetings as well. And then y'all want to know about two significant truths and one major lie. Well, we have an incredible staff who are extremely busy. We do ask that you please be patient because good care does take time. Our staffing model, like I said, is updating, but we have incredible people here that really are engaged and are doing their best to help you. With that, in the past year, we've had over 8 personnel deployed for Operation Vigilant Sentry down in Key West and in the Florida Straits. So our folks have been busy providing EMT support, independent duty support, or augmenting onboard FRCs and working both in Miami and in Key West, providing some type of medical logistical support, or also acting as behavioral health technicians. And that includes myself. I was down there as a medical unit leader, and we've had pretty much every one of our medical providers down there support in some way, shape, or form. And then one lie, we always hear this. A member will come into medical or call the duty HS and say, I'm sick, but in order for me to go home, my supervisor says I need a SIQ chip from medical. And that simply isn't true. As supervisors, you can direct your members to stay home or leave and go home for the day if they are sick. We saw this especially during COVID. Use your best judgment as supervisors. If somebody has cold and flu-like symptoms and they need to go home, send them home to help preserve the rest of the workforce at work. Now, if that patient or that member is still exhibiting symptoms or they're not improving at all, and especially if they have a fever, have them follow up with medical the next day, and we will get them in. This also helps create a buffer in timeliness and care. If it's something simple where the supervisor can send that member home for rest and relaxation so they can heal, that's an easy day all day, and it doesn't require a SIQ chit. But now if those symptoms continue to be burdensome, then absolutely that member should follow up directly with us at medical, and we will do our best to get them the care that they need. And that's it. That's it for medical, and welcome aboard.
I hope you enjoyed this edition of Workforce Transition Resource Team.